Good morning, everyone, and welcome to today's update from the government's Health Plan Implementation Task Force. Bonjour tout le monde et bienvenue à cette mise à jour du groupe de travail sur la mise en œuvre du plan de la santé. Speaking today are task force co-chairs Suzanne Johnston and Gérald Richard. Les porte-paroles aujourd'hui sont les co-présidents, Madame Suzanne Johnston et Monsieur Gérald Richard. The co-chairs will each make a statement, and then we'll take some questions from members of the media. Les co-présidents feront chacun une déclaration et répondront ensuite aux questions des médias. Ms. Johnston.
Thank you very much, and good morning. Gerald, good morning. Nice to be here with you today, being able to bring some information and news on the work that we've been undertaking over the last few months. It's been just an honor to be able to be involved in that and to be having time to work across the province. As I mentioned earlier to some of the media, being on camera isn't my day job, and so if I stumble around a little bit, I ask your forgiveness on that front, and we'll do our best. I'm most excited about hearing your questions as we move forward. It will guide the discussion. And Gerald and I will probably have a little bit of a dialogue on a few things as we move forward, because that's sort of how we've been working. So I'm going to read a few comments so I don't miss some important things, and then I'm going to speak about a couple of examples, and then I'll turn over to Gerald, and if so required, Gerald can interrupt me and we can just have that dialogue right in the moment. So easy peasy, that's where we are today. So over the past months, we've had the pleasure of traveling across the province with a simple mandate: listen and learn, learning as we go. It's our belief that healthcare happens, and healthcare happens in community. It's been very inspiring to see the passion that New Brunswickers have for healthcare. And it is in those rich conversations with people in communities across our province that we are learning how we can work together in collaboration to improve health. We've been hearing a lot about access to services, especially, and this is not new to any of you, primary health care and how technology can assist us with that. Communities have been expressing a desire to do things differently as well. What might work in our community would be very different than what might work in another community. For example, moving towards integrated community collaborative care using team-based care models where different health professionals are working together to their full scope of practice has been demonstrated across the country to produce effective outcomes for patients, to increase the satisfaction of the providers, and to keep them grounded in community for a longer time. So it's been pretty positive understanding and translating that into New Brunswick. As co-chairs, we're making connections and linkages so the system can support environments for healthcare that are innovative and citizen-focused. The health plan said clearly that we would start with the most pressing issues and move on from there, and that's been exactly what we were doing. We've made some pretty good progress in a short time with some initiatives, and one might consider those initiatives to be not as powerful, perhaps, in its early stages as one might think. For example, in order to move forward to work with connecting people to primary health care in this province, for example, there were some things that needed to be put in place in the immediate short term to shore up the system of care. And that example would be the virtual appointments through Visit New Brunswick. It's provided opportunity for people to have access to care in ways that they may not have had before. We learned a lot through the pandemic. We learned that eVisit has produced some good results for people. We learned that referrals to an appointment with a nurse practitioner or family doctor could happen through 811. So those things have been happening in the province. Not the entire solution. Again, it's another piece of the puzzle that makes a more comprehensive system of care. We've learned that the establishment of one-at-a-time therapy in every mental health clinic has made a big difference to people. It doesn't mean that you only get one opportunity to have that. You can have one-at-a-time therapy multiple times. And if it is discovered in that process of one-at-a-time therapy that you need more, then those referrals can be made. And so it is, again, adding to a more comprehensive system of care across the province. It's eased access issues for many people, and it's really provided what we like to say a foundation for future growth. So although it may sound that it's piecemeal, in a sense, there are pieces of things that are added to the puzzle, and when that opportunity to bring all of those pieces together is more evident to people, then we can start to see that it's a system of care that's arising from that work. We've worked really wonderfully with several municipal leaders as well, and it's really to their credit that they're stepping up and saying, we'd like to work with the regional health authorities. We'd like to work with the co-chairs of the task force, and we'd like to bring conversations around our table in community. And that's been very, very exciting to be able to do that. And community care models that are supported in community, it's been proven they work, and people stay there better. There's positions right now that have been posted for nurse practitioners as part of integrated community care in a number of communities, to name a few: Dalhousie, Sussex, Fredericton, and they're aimed at improving primary health care services to patients. These are good examples of things that we can do when we come together collaboratively. There's one other example that I like to speak about, and it's an example of a program called Nursing Home Without Walls. And it's a program that was developed by a researcher at the University of Moncton.
Oui, Dr. Suzanne Dupuis-Blanchard.
There's collaboration right there. Did you see that? Dr. Suzanne Dupuis-Blanchard. And she's done some very interesting work, and working in partnership with social development and supported with that team. It's been exciting to hear more about how individuals are supported in community to be able to manage and stay in their own homes and extend their time being independent, as much as all of us would like to be, and yet supported at the same time. And it's different than extramural, so it's not about coming in and providing health services. It's a very social-based program where people are checked in with, that there's opportunities for socialization, that we have a voice on the other end of the phone some days when we're feeling lonely or isolated. It's somebody checking in to make sure I took my medication like I'm supposed to, and have I eaten my lunch today? It also includes things like transportation to a local residential care facility where I might have opportunity to have a bath, where there would be a meal available that I could take home leftovers so that I could have a warm dinner that evening again, or lunch tomorrow, or it could be about foot care. But more than anything, it's about the opportunity to socialize. And there's a great story from the community of Lamech of a gentleman, and we do have permission to talk about the story, not naming names, but an individual who was enrolled in the Nursing Home Without Walls program that really benefited from it. And there came a time when that individual then needed to enter residential care. So rather than a pathway through acute care hospital waiting for an admission to long-term care, he was able to transition directly to the long-term care facility. And according to the leaders at that facility, two great leaders, they said it usually takes people about a month to settle into long-term care. And in this instance, because the individual had been going for meals and baths over a period of time, in a week it was like he was leading the card game. So I just feel like it's a really important program. The outcomes are good. And Gerald, I'm going to turn this over to you. Maybe you'd just like to talk about Port Elgin for a minute.
Sur le projet. Merci beaucoup, Suzanne.
Yes, thank you very much, Suzanne, and hello to everybody. It's a pleasure to talk about Port Elgin. It's linked to the project that Suzanne just mentioned, we're talking about Suzanne Dupuis, who's talking about this in this community and in Port Elgin. What's important is that we're starting to have data to show, because we're coordinating services, we are reducing the number of visits at the emergency rooms in hospitals. So we're giving a quality service, but also we're keeping the people in their communities, which is what they want. It's a great example to reproduce throughout the province. Another model that's interesting, in fact, I would even call it a jewel here in New Brunswick. Suzanne talked about Lamech. We didn't just went to Dalhousie, Sussex, and Fredericton. We went throughout the province, but we went to see where there were examples that should be seen throughout the province, really. In Lamech, among others, we met with Mayor Jules Haché and his team and people from Vitality, and there's a community center project where we would integrate all the different services for the community. This is something that is rather special to see. What we did, Suzanne and I, is we were working with Dalhousie. We went to see the Normand Pelletier, Mayor of Dalhousie, as well as the Mayor of Balmoral. We went to Lamech. They presented what was happening there, and these were what we tried to see was what are the principles that make it work in Lamech, this integration of the health services. And one of the things that came out clearly was, first of all, to have an advisory committee, which was there for many years already. But this advisory committee, which is composed of different people throughout the area, and they meet every 8 weeks to analyze different data that they have to see how things can be improved when it comes to care to the people in that zone. So that was one of the principles that we found very interesting. The other thing that was mentioned, and I'll name her, the Shelley Robichaud, the director who made the presenter, and she's a member of Vitality. She talked about one of the things important was the coordinator who was set up by Vitality who works to make connections with different services. This was for us a success. Now we want to make sure that we look at the data to make sure that there's a true impact. When we left there, both mayors who were with us brought all this back to their communities, and we're trying to see how we can apply one way or another those principles in their communities. Also, we shared during our conversations the same thing with Sussex and in Charlotte County, where we met a committee, and the same thing as well with Fredericton. We started having conversations for Fredericton. Also, we had a great meeting with the Kent Commission. Mayor Pierrette Robichaud, who was presiding that board, and they set up some time ago a health committee which looks at the different needs over their territory. And we met already twice, that committee. The committee presented by Roger Doiron, we had great meetings, and we're learning as much from their meetings that we could talk about when it comes to the plan. So these are the examples of meetings we've had. It's important for us to say the work we're doing is modeled on success we had at the beginning of the pandemic. We had a work group or task force with Dr. Leblanc, Dr. Gordown, Dr. Russell, and others, and we had an operational group that was working or meeting daily at the health department. But it wasn't just people from the department. There were different people from different departments and the different health authorities that we were collaborating together to solve problems that were rather complex, especially at the beginning of the pandemic. And very soon, when we saw the people collaborating with a common goal, it was easy to find the solutions. And the solutions were innovative. They were unique to New Brunswick. We looked at research, but we looked at what was being done elsewhere, but often we found solutions that were unique to ourselves. And so based on that, Suzanne and I we had this task force, but we also had a rather regular schedule. We would meet with the CEOs as well as with the two deputy ministers, and we would meet with we would get updates on the different projects that have been put in place since the beginning with this plan. And so far, we can say that there are 48, but these are all underway, and they are all linked to the 5 pillars of the plan, as well as the catalyst, which is the matter of human resources. Each week we meet, and also we have to meet with Cabinet through Minister Shepherd and Minister Fitch and the Premier. So every 2 weeks, we meet those government people to make sure they have an update on the progress made. As well, we want to do this regularly, perhaps quarterly, to make sure that we can be accountable to the public. As well, considering where we were during the pandemic, we had a dashboard which was accessible to the people and would show important data on the evolution of the pandemic. We want to do the same thing, and we've been working on that for a few months already not Suzanne and I really, but the team of people who are much more qualified than we are, who are working to make sure we have a dashboard so the people can see that data. As well, we have worked very hard with those different pieces of the system to try to determine important targets connected to the 6 pillars. And those targets, we started that. It will be linked to what I've been mentioning with this dashboard, and you will be able to see the progress in real time. Now, one thing, we aren't trying to find perfect solutions. We're trying to find teams who can work together to look for solutions and adjust things when things don't quite work. That's important. I'm going to stop at this point to take your questions because I think this is the most important part of our update. Thank you.
Je tiens à remercier Monsieur Richard et Madame Johnston. I would like to thank Mr. Richard and Ms. Johnston. We'll now proceed with questions from the media. You have the right to pose your question in the official language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. On va commencer avec Silas Brown, Global. Silas Brown, Global, you can ask your question, please.
Yeah, sure thing. Thank you. Obviously, staffing remains a pretty large bottleneck when it comes to implementing any changes in the healthcare system. You mentioned that that more positions are being posted for nurse practitioners, but that's not new. There's lots of vacant positions around the province. So just how big of an issue is staffing when it comes to trying to implement this plan?
Well, Silas, thank you for that question. Staffing, of course, is required to run the system. I just read that there's a number of significant shortages this morning, updated from Minister Shepherd on the numbers of vacancies. I'm not an HHR specialist, nor would I want to be. I do know one of our initiatives, one of our supporting initiatives, is around strategies for health human resources. And that team has been working collaboratively to implement some changes in the recruitment and retention of physicians, nurse practitioners, and among all of the people who support the clinicians that work in our system, because it's about that whole team of people. I would, however, purport to say that I am an expert in culture and culture of organizations, and have had the opportunity to work in cultures where I know that not only is it recruitment, but retention, and it is about leadership, and it is about developing the cultures where people can flourish in their work. And so it is part also of the work that we're doing to be able to support and initiate strategies that will enhance the culture of New Brunswick in the health system where people work. They will long to come here and work and stay in our system. So not an answer directly to your question at all. I would leave that to perhaps the minister to speak to later, but for sure we are paying attention to that in a significant way with respect to innovation in recruitment because we're competing with a lot of other people. Thank you.
But it's your responsibility to oversee the implementation of the plan. And so if staffing is getting in the way of that, and you say that this is something that's being addressed, we didn't really hear about any of that today. So I guess maybe it would be better to ask, what is actually being done right now to address these recruitment and retention issues as part of the overall implementation of the health plan?
So a number of strategies, in particular, partnering with other ministries that have experience in that recruitment. But also, I think you'll be pleased to see later when our website comes up this week, and you'll have the dashboard on the work that we're doing and some specific accountabilities that I don't have right here at my fingertips today, but there will be more concrete information available on that strategy.
Thank you, Silas. Michel Corriveau, Radio-Canada, avez-vous une question?
Oui, j'ai deux questions.
Yes, I have two questions. The first is for Mr. Richard. Could you tell us clearly what exactly is your role when it comes to implementing the plan? What do you have to do exactly for implementing the health plan? Do you present recommendations to the government, specific recommendations, or... Well, basically, yes. Explain to us what your role is. Well, the mandate is clear for two things. First of all, we're going to meet the people in their different communities, and we're going to try to connect pieces. That's part of our role. And we're going to learn. Mrs. Johnston mentioned this as being one of our roles. The other one, which is very important, is to make sure we see progression and the implementation of the plan. So we are regularly meeting weekly. The CEOs, the two deputy ministers of health. We started this a few weeks ago because there had been the Omicron wave that had affected our work in January. But we started meeting every week, and we also asked to have a team in place, an operational team that would meet Monday mornings. This is staff from both health authorities as well as extramural and Ambulance New Brunswick, and they meet with social development and health, and they look at the pillars that have been identified in the provincial plan, including the catalyst for human resources. So we can talk about 6 pillars, really, and we look at these things in a concrete way with project managers who try to set up steps along the way. And we've asked for targets, as I said, that will be put on the dashboard, I hope within a week, to make sure that the public be properly informed of those pillars. That's our role at this time. Follow-up? Yes, perhaps a question, a more specific one. When we talk about the health plan, there had been discussion about the minister and the premier making sure that there would not be any doubling of services, that the resources would be better used, and that some services would be centralized. I believe you may have a role when it comes to that. What was done when it comes to that? Are there services that have been centralized or will be? We had, at this time, the work we've done is to meet the communities. We haven't talked about centralization of services at this time. We especially listen to the communities to see how we can, educate concerning the 5 pillars of the health plan and see how those communities can help us. I mean, we were in learning mode at that point, but how those communities can play a role. And as Suzanne mentioned, they really want to take part. The example is when it comes to human resources. How do we recruit and retain people in their communities? They want to play a more specific role. And as I said, we looked at we set we set up targets, and we linked all those to the 5 pillars. That's what we've done so far. Thank you, Mr. Codiveau.
So this is a question from Ms. Johnston. Ms. Johnston, I spoke to you not long after you were appointed, you and Mr. Rashad. You mentioned during that interview that there were going to be some tough conversations and some tough decisions. Have you had any, and have you made any, or have things changed? What can we expect? What can New Brunswickers expect?
Oh, thank you, Andrew. And I was just recalling earlier about your comment around Mission Impossible. And so thank you for that. It was interesting. There is a sequel coming out next year, by the way, just so you know. There are difficult decisions that we need to have. And some of those difficult decisions come from within health professionals themselves. And sometimes it's about, as a health professional, what do I need to give up and support communities in doing? That would be something that I would give over to communities to do. So just by way of example, in the health professionals, and I am one, so I can speak to it, we like to keep tight control of stuff. We like to know how things are going. If it's an OR, you want that to happen. You want that health professional to keep tight control of that surgical procedure. When we're in community and working in community-based environments, it's about who are the other people in communities that can do things. And just to draw you back to Nursing Home Without Walls, not to belabor the point, but the people that are doing the work in that program aren't nurses, they aren't doctors, they're community folks. They're ordinary people that are looking out for their neighbors. And I think there's a message in that for us to have. There may be difficult decisions, and one of the things that many people have asked us is who is this task force, and where are they sitting, and when are they doing a report? That's been something that we've heard quite often. And Gerald and I say that the task force is the people that come together in community to look at what are the short-term solutions we can implement to stabilize, as in stabilizing the health of New Brunswick's system, and then how do we add innovation to that? How do we bring other thinkers to the table, not the usual suspects, to help us look at things a bit differently and consider new ways of learning? This answer today to difficult decisions, all of these things are difficult. How do we transport people across the province so that they can arrive to care? How do we use virtual care differently? How do we use devices like watches that monitor our heart rates and our results from our lab? And so one of our initiatives is about being able to access our lab results on our iPhones or through our computers, and that will be coming to New Brunswickers to say, whoops, and we all know on a Monday morning when you jump on the scale, something needs to change if it's not heading in the right direction. When we have our hemoglobin A1C measure, which is a measure that's very important to people who have diabetes, and I see that it's not where it needs to be because I looked at my blood result, I know there's some immediate changes I need to make. One of those being, I need to look at making sure I'm following my plan. Do I need to call my dietitian? Do I need to connect with my primary care provider? What do I need to do to change that? And so it's about empowering people to do things. So the difficult part, yeah, I think Gerald said that actually, Andrew, in the interview. There are going to be some decisions as we talk about it. We will make recommendations on things as we move forward about ways that we may move forward, but they will be in collaboration with community, with the health authorities. What's going to serve well for New Brunswickers?
Mr. Waugh, do you have a follow-up?
Yep, I do, thanks. So Premier Higgs and Minister Shepherd have repeatedly said that New Brunswick's healthcare system is in crisis. This morning I reported there are more than 1,700 permanent job vacancies in Horizon and Vitalite. You guys have been tripping around the province having a look at it. Do you agree? Is it in crisis? And, you know, I mean, I don't suspect you can fix this quickly if you agree that it is. So how long is this going to take?
Well, that's quite a significant question, Andrew. I have to think about it for a minute. I guess the way I look at our system of care in New Brunswick is that we have a province that has a geographical footprint that's not so unwieldy that we're not able to get across it today. We're able to make our way from one end to the other, and we have a system of health authorities in the province that are charged with delivering acute care to people in the province, and we have supporting that system public health, mental health, home and community care structures, and numerous people that work within those contexts. And so when we think about being in crisis, it is when we think about how many people, small example, but how many people are going to the emergency room that could be receiving care in another environment. And so it's a little bit of a barometer for the health system when we look at that emergency care. And we have a way of categorizing people that come to emergency, and we triage people based on the urgency of the care requirements. And so when we have people that could be seen in another environment, whether it be by a pharmacist, whether it be a nurse practitioner, whether it be in a primary care or walk-in clinic, whatever that environment might be, we would want those people to seek care there. It may be an e-visit. Right now, the default button goes to emergency care because we don't have that other system in place. And that's why our focus has been on, let's start looking at integrated community care and community. How do we use the professionals that we have to their maximum so that they can provide that care and those interactions with the people that require care in that moment? When that happens, and when you can start to think about how to redirect people from an emergency room, then you start to see flow through the system improving somewhat. You may have read in the Globe and Mail this morning, I think it was, on the solutions to pressures in the community hospitals and the emergency rooms comes in adding more long-term care, doing this, doing that. And really, is it the solution? We've been trying to do it for years. When Tommy Douglas invented Medicare, he didn't think we were going to live to be 105 years old. He didn't even envision a system for that. Medicare was for the farmer that fell off his tractor and broke his arm. Medicare was not for somebody like me with 3 or 4 chronic diseases, or somebody like my great aunt who might still be living. I mean, it's a different world, and so we have to think differently about the system. How do we bring innovation? How do we bring new thinking to our work? And so, is it in crisis? I would say we have work to do. This work doesn't happen overnight. And at the same time, when you start bringing people together, there gets momentum. Gerald mentioned Lamech. Let's take that best practice and leapfrog over that. Take the good pieces, put it to the next one. It starts to scaffold and build that way. And that's really been our approach. Long answer, I apologize.
Thank you.
No, thank you.
Sarah Derry, Radio-Canada.
Sarah Derry, Radio-Canada Acadie. Yes, my question is for Mr. Richard. Concretely, for the people at home who are wondering how this plan is moving ahead. Okay, my colleague has just said that we are missing thousands of people, and people are waiting hours at the hospital. I mean, what does this mean for the people of New Brunswick who are worrying about the situation in the healthcare system? What I can say is, to come back to what Suzanne just mentioned, it's a matter of access. That's a big challenge. When I think when we talk about access, we think about access to a family doctor, access to practitioners for health care, for primary care. That's the greatest challenge. That's what we hear about. So to meet that challenge concretely, there are different approaches. We could add human resources, and that was discussed a bit by Suzanne. We have to work on that. And in fact, for what we added is that we're starting to work with post-secondary education, training and labor to connect with the communities. We're not just affecting Horizon and Vitalite to do recruitment, but we're trying to have processes to improve recruitment and retention. So that's concretely something very important. But another important thing when it comes to have access to primary care is to make sure we connect the different services within a community. We know, and Suzanne mentioned it, it's tiring when we have not the team, but a long waiting lists of clients that for family doctors. I mean, we have to do things differently. We have to find different ways of doing things. And in New Brunswick, there is Family Doctors New Brunswick, which includes about 60 practitioners. We meant different clinics, including here in Oromocto, where there's a team of family doctors with nurses and nurse practitioners and other services that connect people to mental health services and others. So if you take let's say that you're a client, a patient, and you contact that clinic, within 24 to 48 hours, you will see somebody. Somebody will meet your needs. We have to have that throughout the province. The challenge for human resources is there throughout Canada and throughout the world. But if we look at what's happening in Oromocto and what's happening in Bathurst with these models, I think we can work on that and even add to what is already working well. That is not being done throughout the province. There are little pockets here and there. And our work is to make sure those connections are made and see how the municipalities can integrate those models throughout the province. Concretely, Mrs. Deary, that is what I think is the most important thing that I can give you as an example. And perhaps, maybe you answered it a bit, but perhaps just repeat it in French. When it comes, I know it's going to take time for recruitment and everything, but for people who are at home and are trying to know when that they will get good news when it comes to this to reform. I mean, how long will it take before we see improvements when it comes to waiting lists, slack of staffing, etc.? The work we did throughout these months were to get these key performance indicators to make sure that the people will see progress. And if this doesn't work, then we have to adjust our planning and our interventions. That was the first exercise, because to talk about a plan, just to talk about a plan, that's not enough. We have to have targets, and that we should be able to share them on the provincial dashboard so everyone can see it. So for access, there will be indicators to see if we can meet certain targets, to see if we're going in the right direction. If we're at about 60,000 people in New Brunswick who don't have a family doctor at this time, well, by a certain date, you should see whether there's progress or not. I hope there'll be progress. I mean, there are projects in place right now, and we're going ahead and are starting to show results, but we want to show it through data on a dashboard, and not just for us internally, but also for the people in general. They should be able to see that, I hope, over the first weeks of July. Okay, thank you.
Brunswick.com. Brittany, are you there? We'll come back. Alexandre Boudreau.
Alexandre Boudreau, Acadie Nouvelle. Hello. My question is also concerning recruitment and retention. We have many specialists who left recently, including oncologists at the Dumont Hospital. But do you think, are you be looking at the reasons why the staff decide to leave? Are there any immediate changes needed to retain these people? I don't want to comment directly the example that you've just given. All I can really do is repeat what Suzanne said concerning Mr. Boudreau and the organizational culture for the large organizations such as Horizon and Vitalité. We have to look at that, and if we can help improve organizational culture, that will help for retention and recruitment. I know there are all sorts of initiatives in place in the health authorities, and they could probably talk to you more directly about them. But we've had conversations with them on Wednesday afternoons, and we've just talked about organizational culture, and we have to do things differently in New Brunswick because we want to keep our people, not just the people you mentioned, but people throughout the system. Follow-up question? If I understand for the first question, the recruitment strategies, you're not hands-on when it comes to recruitment, are you? It's a catalyst. It's not one of the 5 pillars in the plan itself, but you will see that there's a catalyst, which is human resources. As one of your colleagues said earlier, the two are connected. We can't just set that aside. What I mentioned a little bit later in the end, or earlier rather, I said that we were meeting with the municipalities. What we're trying to do for recruitment is to include municipalities who want to play a role. I could give you Suzanne talked about the passion of the mayors. We saw it in the different municipalities that we met with. They want to play a role for recruitment and retention. They don't want this done in a parallel way. In the work that we're doing, we want to have processes that we use these people in the municipalities properly because they know their areas. They know what they want to have for economic development. How can we play a role? What processes do we need so that we can use them as leverage in other municipalities? Okay.
Hello, yes. My question is for Suzanne Johnston. So the health plan says the Patient Connect New Brunswick list will have been eliminated and replaced by the New Brunswick Primary Care Network, where anyone without a doctor or nurse practitioner can access one in a timely way. How close are we to this goal? Like, how many people are on a wait list versus before this health plan was implemented?
Actually, the wait list is growing. I think as more people are moving into the province, more individuals are adding their names to the wait list. I think Gerald said today it's at around 60,000 individuals. It's a very serious challenge that we're faced with. We do have, I would say, a very comprehensive plan that is becoming finalized, and hopefully being able to bring forward some news about that Patient Connect list and that transformation. It is, however, important to note that part of your question, Hannah, is around when will it be eliminated. This work is going to take time, and that's why I talked earlier about some of the other options that we have in place for people around the e-visit, around 811, and being able to do that. So even today, if we had a perfect solution in place, 60,000 people aren't going to get attached to a primary care provider overnight, because, and I know that you know that, and I'm not trying to simplify it in any way, but I would like us to think about how do we start to create that system where people have that access. And it won't be any one thing that creates that system. It will be multi-pronged. It will have many, many facets to it. And part of that is about how do we support people in getting that care? How do we bring people into a new system? Because that will take time. When a physician opens a practice in a community, and if that physician had a team with nurse practitioners working with them, other office practice nurses, perhaps licensed practical nurses, behaviorists, life skills coaches, all that variety of people, when they onboard a patient into a practice, it's a It's a significant amount of work to do that. And so it's about the health history. It's about determining what the pressing needs are of the individual. It's about medication reconciliation. So there's a number of processes that need to take place. And so when we think about going to a walk-in clinic for today and saying, I've got what might be an infection in my arm, it's very different than getting onboarded into a primary care provider system. And so I would like to say that we get started on that work and that we start moving through that work. And when you start to see the dashboards that will be posted on our website, which will be going live this week, you'll start to see over the month of July into August some progress on how many people are getting onboarded into that new system. And that, I hope, will give people some encouragement that things are not inert, rather that things are making a shift. And in the meanwhile, we have e-visits, we have 811, and we have, of course, your local pharmacists that can do so many things. And so I think we want to think about how do we spread the message that there's more than one way to access care and more than one way to support one another in this, and raising your hand and asking those questions. And I would just call on people too to, look after your neighbor. Make sure that you take a look at the people that are around you and have they got what they need.
Follow-up question?
Yes, and what has been the cost and projected future cost for the health plan's implementation?
Ooh, that's a question I don't have at the tip of my tongue, but we'll need to follow up. I'm sorry, Hannah, I don't have that today.
Thank you. Laura Brown, CTV?
I think she was referring, I guess I'd like to know more about the primary care network, because last month the health minister had said that it should be up and running by the end of the year, and even that was delayed by about a quarter. So I guess I'm wondering if you have an answer to if that's still on track for the end of the year.
I guess I don't have that answer today, but I would encourage you to follow up with the minister on that.
Have you been noticing or hearing from citizens when you've been traveling about their concern, they're hearing and they're learning about the leave of some specialists like oncologists that we've seen in the last week? Have you been hearing about that concern, and what in this health plan has been targeted towards that?
Well, I personally, in our travels, we haven't heard about it. Of course, we know about it because we meet with the CEOs. And we're tightly connected with the deputy minister in our conversations. And so I would suggest that perhaps a follow-up directly with the ministry on that would be good.
You're not concerned, though, at all with I guess in the press release it had mentioned that people understand that they can't get all services in all places. But I'm wondering if we have needed services at all in some places.
It is a very important aspect of a care delivery system to have strong primary care, to have an acute care system that's staffed with the right specialists that are in the right place to provide service. Absolutely, we're concerned about that.
Thank you. We will try again. Brittany Gillaforte, are you there? She's not there? Okay. Do either of you have anything you would like to add before we conclude? Est-ce que vous avez quelque chose à ajouter?
I thought I would like to add one thing, because Gerald has such passion in his heart about the grand seduction when he talks about communities and talks about how that small community of Bell Island in Newfoundland came together to create an environment where people want to come and practice. Now, I read that Bell Island is losing their last physician again, so it lasted a long time. So thinking about how those models work. The other important aspect is we talked about Family Medicine New Brunswick. There are multiple models of teams that work together across the province, and we've seen that. And so it's important message that it's not a cookie-cutter approach to the care that we're doing, and that part of the work that we're undertaking is it's short-term, shoring up, stabilizing, and then medium and long-term thinking. So it is about an incremental plan of activities that we're doing. And I think with great humility, thinking about stepping and learning as we go, and sometimes we have to step back a little bit and say that didn't work quite as we thought it might, and so we tackle it from another angle. And it is in the collaboration and working with the people that we have in this province that we can move this forward together. That's my closing comment. Thank you.
Merci, Suzanne. Moi, j'aimerais
Thank you, Suzanne. I would like to perhaps thank the staff, the medical staff throughout the province that work very hard. We've been working for the last 2 or 3 years. I mean, I didn't have a chance to thank them all personally, but I think that if there's something that is fine here for our future of our health system, I think New Brunswick can become a model. We often talk about what isn't working in our system, but I've seen lovely, positive things, innovative things, and I think we can get there when we work together. I would also like to say that if you need to reach us, please, I mean, especially speaking to the people listening to us, if you have possible solutions you'd like to share with us, we would love to meet with you and see how we can integrate that into the plan. Thank you so much.
Online, the Patient Connect waitlist, I have found those numbers. In February, we were at 55,000. Because of all the announcements, people started signing up. We registered a bump of 11,000 people. 3,000 people were referred to physicians for a net gain of 8,000, which is why we are now at 63,000 on the list. Alors en français, on était à
So we were at 55,000 at first, and there were we made announcements, and we had 11,000 people who were added, and we were able to connect with the doctors for about 3,000 people. And so there were 8,000 people who are now on the list, 8,000 more, so we're now at 63,000 people on the list.
Ça conclut notre mise à jour. That concludes today's update. I would like to thank our co-chairs, Madame Suzanne Johnston and Monsieur Gérald Richard, for all of their help today, and all of the media for their interest, and of course the people at home.
Thank you.
Merci. Bon après-midi.
Merci à vous.
Thank you.